He wanted to do something and completely gave up alcohol for a year. Then his sperm analysis improved by almost 100%. This video makes it easy to see that this is a normal or almost normal semen analysis. We have the appropriate density, the sperm are moving in all directions, and the morphology of the sperm's appearance is also without pathologies. This means that you can see that it makes sense to start the appropriate therapy. Namely, change your lifestyle, maybe lose a few kilograms, at least reduce nicotine intake, ideally quit smoking during this time, and drink less alcohol. In many cases, the subject is not properly explained. When you enter a reproductive center, you must also receive explanations from doctors and biologists about how to pass a sperm test and how long before it makes sense to wait. So, people still think about abstaining from ejaculation for as long as possible and then achieve the best semen analysis. This doesn't seem right. This means you know that the waiting period, i.e., the absence of sexual intercourse for 2 to 3 days, is optimal. Despite Stefan's improved semen analysis, it did not help. Pregnancy did not occur. At the same time, Leonie is being examined. I'm young. Why do I need IVF? I don't need IVF. I'm not 40 to 45 years old. My career became more important to me, and I've always been healthy. Everything was fine with me. There were never any deviations. I don't drink alcohol at all. I've never smoked in my life. So what could be wrong with me? This was a bit, really, like a blow to the head. There's something wrong with you. Because of this, yes. And if you then Google it, everything gets worse. It just drives you crazy. An unfulfilled desire to have children causes pain. Many people in the environment do not realize what constant alternation of hope and disappointment causes and how psychologically stressful it is. You can't understand this strong desire to have a child until you are in such a situation. This process. Everyone around me was pregnant, and I wasn't. I couldn't see baby strollers or pregnant women. There was always this feeling, why them and not us? It makes you feel lonely and lost, alone. I can't participate in such conversations. Or different people in the family environment start talking to you when you already have a child because you are already married. When questions keep coming up. Everyone, yes, it's about time, you're not that young anymore. And often, you don't even know how to behave, yes. I feel like I can go out and say, yes, we want to have children, please believe me, but don't look at my belly every time, please stop asking me why I don't drink alcohol. If they understood that, it would be so great. Then we would have a lot less moral pressure. Questions are met with advice, a lot of advice. For example, this, yes, you need to let go, because I know a couple who stopped wanting to have children and suddenly she became pregnant. Relax, then it will happen. You are under such strong stress, if you don't relax, then nothing can happen. Honestly, if it was just relaxation or stress relief, and then it worked, I would go on vacation again the day after tomorrow, no problem. But it's not like that. It's a body that shows you its limits. In Kiev, surrogate mothers are waiting for their next checkup. Ultrasound to see if the baby is developing well. Elena already has a 12-year-old son. She is now 6 months pregnant. It's a girl. She's turning away. Girls usually hide more during ultrasounds. Elena, have you already seen the baby? Yes. It's wonderful. Indescribable feelings. Elena has become a surrogate mother for the 4th time. I was not emotionally ready during the first pregnancy. I thought everything would be a little different. During subsequent pregnancies, I contacted the parents. It was much easier for me because I knew what kind of people they were. The 36-year-old woman has already carried a child for parents from Spain, the USA, and Italy. This child is for parents from Germany. If there is contact with the parents during the pregnancy, it is much easier for me emotionally. Even if I know that it's not my child. But without that contact, I am afraid to give the child to people unknown to me. Because I don't know how the child will feel or where he will be. This is my biggest concern. The decision to communicate with the surrogate mother can only actively come from the future parents. To be a surrogate mother in the clinic, women should already have their child to know what to expect regarding pregnancy and childbirth. Of course, I talk to the baby. It's a form of love, but not maternal love. It doesn't matter how others perceive it. The child is a big part of me this year. And, of course, there are always feelings. Future parents pay for their child from 40,000 to 65,000 euros. The main part of this income goes to the clinic. According to the clinic, the surrogate mother receives 22,000 euros, 6 times the average annual salary in Ukraine. However, the full amount is paid only in case of the birth of a healthy child. What can I say? With the start of the war, I lost my job and had to support my family. Perhaps if not for the war, I would have come to the clinic later as a surrogate mother. But this in no way harms my pregnancy. I try to maintain a stable emotional state because there is no other way. We try to stay strong. Religious people say that I am sinning. Others say that I am selling babies. But that's not true. The money is compensation for the time and everything associated with it. Some couples have been trying to have a baby for years and can't do it. And I make them very happy with a child. Finding future parents for an interview was not easy.